Dr. Peter Leo, and I'm here to answer some of your eczema questions. Today's question is, how do we treat eczema? This is my favorite question, and what I'm very interested in is how do we get people better? Well, we think about a few different areas. The first, of course, is we want to find and eliminate any possible triggers that we can. This can be more difficult than it sounds because some triggers are allergens that we can actually identify, but others are simply irritants, and we don't necessarily know which is going to be a higher yield. Sometimes people are not able to avoid those triggers because of a job or because of a family situation, so we have to work with them. Once we've avoided the triggers that we can, we like to think of a few different areas. The first, and perhaps the most important, is the skin barrier. We want to support and strengthen that skin barrier because that's really what's going to help keep the water in our skin, keep it hydrated and moisturized and soft, and it's going to keep out all of the things like allergens, irritants, bacteria, and viruses, and even fungus that can enter our skin and cause worsening of the disease. So we do things like natural oils and moisturizers to help protect that barrier. The second part is going to be anti-inflammatory. The immune system is there to help protect us, but in eczema it seems to be going haywire. It's attacking the skin, damaging that skin barrier, and making itch, which is also causing us to scratch. We want to slow that inflammation down, and we have a number of anti-inflammatory creams that we can use, and in more severe cases, more powerful systemic medications. We also have things like phototherapy, light therapy, to cool down the inflammation. This is very closely related to the itch because we know that much of the itch is caused by that inflammation, so we think of these two together. For itch also, however, we can use things like camphor and menthol, and sometimes even things like pramoxine, topical agents which cool the skin. Some of my patients really like to use ice packs as well, and that ice can have a cooling and soothing effect on the nerves, which cools the itch, which is really helpful. Finally, we have bacteria, and this is a hot topic in dermatology. The bacterial overgrowth seems to be playing a role in atopic dermatitis, and we're trying to understand better how we can get rid of the staph bacteria, which is creating a toxin called delta toxin, which seems to fuel the disease. We don't know everything about this yet, and we're still trying to find out the safest and most gentle way to do this. Lots left to learn, but that's some of the ways we approach treatment. Unfortunately, we don't yet have a cure. However, for most patients, we can get them better so that they can resume a normal life, get back to feeling good, sleeping well, and most importantly, being able to concentrate on the things that they want to instead of constantly focused on their skin. We hope you enjoyed the video, and we look forward to seeing you at the next one. Thank you.